Hey guys, so this is a view that you haven't seen for a while, which is me driving in my car because I haven't done it for so long. I am actually a little late for my appointment, so I am just about there. Wish me luck. Help pray that I wasn't too late, and I'm here. Bye. I'm already here. Hello.
How are you?
I'm okay. So what do I need to do? Take mine off?
Not for me. I guess you can wait for whoever else tells you. No fevers, coughing, hospital stays.
Nope. First time I've been even here since.
Nursing homes.
Nope.
Traveling.
How are you?
Managing.
Things crazy lately? Literally first time I've been here since this whole thing. So
There you go.
what do I do with this?
Hold on to that.
Hold on to that. My
And then
turn.
you're going to go check in with Kelly, okay?
Okay. Thanks.
You're welcome.
And then if you need us, we're right here. Sorry.
That's okay. Hello. Checking with Kelly. Tammy. Yeah. And if it shows up that I have hospice ended yesterday. Yeah. Bye-bye, hospice. Hopefully not again. Hopefully this new med will save my butt.
There you go. Step in the right direction.
Absolutely.
Right? All right, honey, you're all checked in. They should be with you shortly.
Okay, so is there places I'm allowed to sit and places I'm not allowed? All right, thanks. Okay, so I'm gonna go all the way over here so that I'm sitting there. There's no spots like that have any marks on them. I guess they just totally take the stuff off. Like it's much less. There are much less seats than there usually are. Oh, I'm ready to go. They're already calling me. All right, here goes. This one just had surgery.
Clean this. I'm sorry, it's a little wet.
Oh, that's okay. How's it been here?
Huh?
How has it been here?
Okay. I mean, we're trying our best. You know what I mean? Sometimes it gets a little nerve-wracking. You're on the lower side anyway, aren't you?
Usually, yeah.
Yeah.
Although right now I'm kind of hyper.
You're 112 over 70.
Oh, that's actually high for me, so.
Okay, so you're okay now.
Yeah.
That's not bad. All right, Ann will be in shortly, okay?
Thank you.
You're welcome.
Hi, Tammy.
Hello, trying to get myself some air.
I know it's hard to wear these masks all the time.
I don't know how you guys do it.
We know we've all determined what we've
You
been
gotta
doing it
do
for
it.
so long now. We
Yeah.
don't have an option.
Yeah.
And if you wear them and you're just sitting and breathing, it's okay.
Yeah.
So you're looking good.
Yeah.
Feeling good?
Hey, best can be expected. So.
Okay. So let me get my computer on here. We called and confirmed that they're taking you off the hospice rolls. It will take, they said 5 work days for that to get
Oh,
into
really?
the Medicare system.
Oh, okay.
And it's going to take probably at least
That's
that
all.
long to get ready to go on this new treatment.
Right. My son knows the name of this medicine that I'm going on. I think I've tried it like 10 times. I'm like, what is the name? And he just says it. I'm like, thanks.
Yeah, you can't. None of us can pronounce it. It's similar to a drug called irinotecan.
Yeah, I saw a girl who had mentioned that she was on that.
Right.
So.
So this is the thing. 2 major side effects. The major side effect is diarrhea.
Yeah.
So if you get diarrhea, have to call and let us know. You have to use some Imodium, so pick up some Imodium.
Should I do that like before I was taking Imodium right away? It's just
No,
hold
wait
off?
and see what happens.
Okay.
but that's a major dose, major complication.
Yeah.
We're gonna do a blood test today
Okay.
that is a marker for if you're gonna have a problem metabolizing this drug
Okay.
that would give you more likelihood of diarrhea.
Oh, okay.
So
So if you have a higher chance,
if you have this certain mutation, you have a higher risk of diarrhea.
Okay.
Like bad diarrhea.
okay.
So we want to know that going in.
Well, one thing my son said is when hospice came, they gave me, for some reason, like 10 boxes of adult diapers. We didn't know why. We were going to give them to someone, and someone's like, keep them. Well, now we know why.
Yeah.
I might be needing them.
I hope not.
Yeah, I hope not.
If you're having that much diarrhea, that won't
Yeah.
be good. The other major side effect is low white blood cell count.
Mhm. Yes.
So that's going to be really imperative that we
Keep an eye
keep
on
an eye on that,
Right.
especially with the wound
Yep.
that's, even though it's not infected now, will have a high likelihood to get reinfected.
Right.
All these medicines you can stay on. We don't need to change anything. The
Okay.
Decadron is helping your appetite, and
Mhm.
if you're going to need to eat well during treatment.
Right.
So we'll do that. We'll keep you on that.
Does it do like any other like normal stuff? Like I know I did hear that hair loss is a side effect. It's not a big deal, but like nausea or any of the other type of things, not as much.
Sometimes the like belly cramping.
Okay.
So we probably, let me see if it's in here. I know with the irinotecan we give a little atropine.
With the girl who was on the irinotecan also said she had some issues with her face, but she wasn't sure if it was from another medicine she was on, because she was also on an immunotherapy. So like sores on her face.
That would be the immunotherapy. Yeah.
Actually, I read that there's an immunotherapy that was just also approved for triple negative.
There's all kinds of
I'm
things.
so
coming out
surprised.
now,
It's so awesome. Just glad to see all this stuff finally coming out.
I know.
I thought it wasn't going to come out because of COVID. I thought all that stuff stopped, like because of the trials stopped and everything. And I'm like, all that's going to just like sit there forever. No, I guess it was already on its way.
Yeah, it was already on its way, and so it was able to like
Just be passed through. That's awesome.
Yeah.
Lots of happy girls out there.
Yep.
And
Yeah.
guys. And guys.
And guys.
Guys,
Yeah.
they get triple negative too, right?
They do.
Good.
Yeah. All right, let me just take a quick listen here.
Mm-hmm.
Okay, deep breath. We'll do the blood work today so that you'll have labs on
Right.
file for the contrast.
Now, do you know how long this actually takes?
I don't. I read that. I know it's 10 milligrams per kilogram. Day 1, day 8, every 21.
Okay, so
But
what
I
does that
don't-
mean? I know you said 20, so it's a 21-day cycle and I get it every 8 days. So is it just every 8 days
You'll
basically?
get it 2 weeks in a row,
Uh-huh.
then you'll have a row off.
Oh, okay. A
2
week
weeks
off.
in a row and a week off.
Okay.
That's one cycle.
Okay.
Then you'll go another 2 weeks in a row and a week off.
Okay, now I understand. Okay.
I don't know how, you get quite a bit of pre-meds with this, so I'm
Okay.
not quite sure how long the infusion takes.
Have you had anyone on the study or anyone do this at all?
Nope,
So I'm the first one again.
you're the first one.
That was the first one with the immunotherapy regimen too. I'm okay with that. Trust me, the word's getting out to other people, triple negatives. So. I remember following this 2 years ago, but I didn't realize it was where it was already. I was like so happy when my son showed it to me.
Well, we knew it was coming out. It's just so funny that you called and knew about it before we did. They might not approve this. If they don't approve it, we can get some CAT scans.
Okay.
If they do approve this, get it done like as soon as possible.
Okay.
So it's done before you start treatment. Because sometimes the
They might need
chemo affects the
Yeah.
chemo won't really affect CAT scans.
So this isn't really a chemo though, is it?
Yeah, this chemo.
Oh, I thought it wasn't. I thought it was some type of another drug. Okay. It just, What I thought it was like a chemo and then something that makes the chemo target right to the cancer, but I didn't know how it worked. So I'll just do more research on my own.
Well, it has a little tag on it, like it's a topo something, so.
Tropo 2 or something.
Tropo 2,
Yeah.
so it will target that, but it's a chemotherapy.
All right.
All right, so I'll ask them to try to process that now for the PET scan.
Okay.
And, all right, give me a minute to go find them. Who? Oh, that was nice.
I just had my blood work done because my, of course, port is crap again. It won't give us anything. It's got the fibrin sheath again, so she's just gonna order some type of a medication that you have to put in before I have treatment to open it up. In the meantime, she just used my arm. She got it with no issues whatsoever. She right in, right out. She's awesome, really good. So basically, I'm waiting for that to come back to make sure all my levels are good. And plus, there's a type of thing they're going to be checking to see if I have, and if I have it, it raises my chances of having a chance of diarrhea with this med. So find out with that too. And then they're putting in for a PET scan. If I'm approved for the PET scan, I'll get that within the next few days. If not, then I'll just do a CAT scan and they'll let me know. I'll find out in a few days about that. And the treatment is going to be on a 21-day cycle. So I said every 8 days, which is true. It's you get 8 days on, so it's 8 days on, 8 days off. Wait a minute, hold on. It's a 21-day cycle, so every other week for 21 days, and you have a week off, I guess is how it is. And there are lots of pre-meds, which means medications that I'm going to have to take before I actually have my chemo. So, and it is a chemo. I thought it wasn't. It's an actual chemo. It's just a new type of chemo. With that, since they don't know everything that's going to happen, they give you a lot of pre-meds. So as far as how long it's going to take, I don't know. But I'll start it hopefully next week. So, alrighty. I'll catch you when I get some information about if anything comes back about this, right?